Yes,
So,
Benjamin?
Sandrine, it's my pleasure to introduce you. So, Sandrine, it's a very important expert from Paris University, and she's dedicated to all injectables, toxins, and hyaluronic acid fillers. And she's one of the very important specialists dedicated to the cannula. And of course, on the purpose of the hands, I think that the location of the choice of the cannula, as you will see, is a perfect choice to avoid, of course, all the problem dedicated to the injection with a sharp needle inside the in direction of the hands. So please, Sandrine, let us know what is exactly the cannula you would like to show us, and what is exactly the product you are going to inject, and where you are going to inject.
Okay, Benjamin. At first, I would like to explain my technique and why I choose this technique, because I saw a lot of doctors injecting near to the wrist. I prefer to inject, of course, in the area of the metacarpus, as our anatomist told us. It's really very interesting because very easy to inject from this part. Easy because we can take the skin easily and we can avoid the problem during the injection. I saw a lot of doctors injecting with a sharp needle, of course, with bolus perpendicularly to the skin. The problem is that we see too much deep injection with the risk with the injection in the muscle. So I prefer to inject in this area. I located my insertion point in the head of the third metacarpus, like this location. I insert the cannula. As you can see, this is a sharp needle, 25 gauge, in order to introduce...
Okay, so that's for the pre-hole.
Yes, that's for the pre-hole. I use the soft fill cannula. The gauge is 25. As you can see in the color of the embasis. 25, why? Because I think too thin cannula could be risked, because we can assimile, cannula, very thin cannula, as a sharp needle. I use the cannula with the red point. I think it is interesting because we can inject and we can see where the product go out. So you see the level.
What's the length of the cannula? Is this a 50 millimeter?
This is a 40 millimeter. It's a
40.
new length.
Okay, so it's a 25 gauge, 40 millimeter,
yes,
right?
Yes. Very interesting because the rheology of the product is very important, and the fluidity of the product is very important when we inject with a shorter cannula. So here you can see the injection level, very superficial between the dermis and the superficial aponeurosis.
Is it a retrotracking injection?
Yes,
so, yes.
fan shape technique. We can inject with a retrograde technique. So you see here, I am injecting the Stillage M, Stillage from Vivaci company. I think that this product is really adapted to this indication because we have to inject a fluid product in order to avoid the puffy hand. Because what we want to have at the end, it's, to restore a little bit the volume. We want to cover the tendon and the vessels, and we don't want to do a big volume on the hand. It's not the deal, it's not the goal that we want to have.
Are you going to choose at any time the same cannula, or are you going to switch to for certain indication to another cannula? So what is your choice?
Yes, usually I don't use the same cannula for every patient. I use a shorter, of course, when we have small hand. You have to see the dorsum of the hand and to see the distance between the insertion point and the tip of the cannula. Usually with large hand, you can use 50 millimeter length. if you want, or you can use longer or shorter. It depends of the, the surface, the distance of the area that we want to treat.
So here is what she did. She pinched the skin, she just went under the skin, and she injected here.
Okay,
So while she was doing the demonstration, I don't know if you saw, but I did the same thing here. And you see that what I injected is exactly over the vessels, over the superficial fascia.
Okay.
You see all the blue
Yes,
color?
yes. Yes, we can see
You see it?
perfectly the level. And
Just,
yes, so it's just under the dermis.
just exactly, exactly.
Under the dermis, and of course, just above the lamina dura, with of course the medium fascia. So, Sandrine, I would like that you begin to explain us concerning the hands. What is your different option? Meaning, are you going to just inject on the area of the joint, or are you going to inject other part of the hands?
So usually I inject, only the area of the tendon, extensor tendon, and the dorsum, because I think that it's the most important to treat in aesthetic area. So we have to consider this area. Usually, some patients are asking for fingers. I think we can go, of course, until the first phalange, but I think that it's not very good. It's not the indication. The indication is just to restore the loss of volume in this part of the hand. Of course, we have to combine treatment. As you see in this indication, she is in the step 5 of Fitzpatrick classification. That means she has an elastosis, she has dark spots, and loss of elasticity. So we can combine with laser and, mesotherapy and of course, injection.
So what is the volume you recommend per hand, for one hand?
So I recommend, of course, 1 ml each side, each hand, 1 ml each hand. I think it's enough. Usually, it's the best quantity to use. But it depends of the indication. If we have a hand very deep, we have to use deep filler, of course. So instead of using stillage M, I can use stillage L or other filler like this viscosity in other brand, of course. And if we have a young hand with only little loss of volume, we can use sometimes no reticulate hyaluronic acid in order to improve the texture of the skin instead of feeling the depression.
Do we have some question? Are you okay with the technique? I think that don't be too shy, and I think that it's quite important for us to share our experience together.
I'm Laith Akash from Amman, Jordan, and my question is, when we are using fat to fill the hands,
The fat?
yes, would you go at the same plane or would you go at a different plane?
Normally, it's exactly the same level, and there is no one difference, of course. And one more time, fat, it's a fantastic product. If you compare with the HA, it's a very good challenger product. But of course, you need to inject exactly on the same level.
My name is Badria Al Mahmoud from Qatar. To fill the
To fill?
Yes, make a filler in the rest area.
Ah, you mean the area was, okay, absolutely not, madam. If you begin to inject this part, you are not on the safe location, and we are not going to teach this area for the moment, absolutely not.
Yeah, I haven't done it, but I've been wondering.
No, I don't think that it's a very interesting location.
Okay. Another question, she just said, the professor, that reticulated and non-reticulated fillers for rejuvenation or volumetric action. Can I understand more about this?
No, reticulation is something with dealing with the volumetry, right? Meaning that, of course, if you would like to have a cover of the veins, a cover of the tendons, you need to have not something just dealing with hydratation, but of course to have quite a good cross-linked HA. And that's the reason, as you can see, all the selection is a little bit balanced between the medium volumetric and the classic product with quite the normal product for any range, okay? Concerning hydration, yes, you can make some non-HA injections on the purpose of some mesotherapy or very light injections, and of course, it's a good combination.
I'm Dr. Sujata from India.
Yes?
I would like to know if there are any safe injection techniques. What are the best injection techniques to inject on the fingers?
To inject on the fingers?
On the fingers.
Fingers, one more time, we are not going to recommend you because, of course, it's a very tricky area, and I'm not sure that it's something quite easy to inject. Of course, you have to make the difference between the fingers and the joints. Of course, joints seems to be, as you can see, quite an easy location, and I'm not sure that you need to inject the fingers.
Sometimes clients do ask for the fingers as well because they say the rest of the dorsum of the hand is looking good, and what about my fingers?
No, if you inject the fingers, you could have some big problem, and we are not going to recommend you to inject the fingers.
Luisa Gutierrez de Colombia. I would like to know about the radiesse technique.
Yes.
Is different or is the same?
Yes, absolutely. You know, radiesse, it's a very good challenger if you compare with the HA, so it's absolutely a good product to inject inside the hands, and the level will be exactly the same, meaning you need to be clear on a very superficial layer close to the dermis. And one of the tips is to pull up the skin before you inject. If you do that, you will be on safe positioning. But if you don't pull up, and if you are not exactly on the superficial injections, pay attention. So radiesse will be on the same. Okay, so Sandrine, I think it's quite important for you that you make a little conclusion.
I would like just to insist about the fact that the hand is very important to consider in our practice, because sometimes we don't think about this, and we have to propose to the patient to consider it, because there is an harmony to conserve between the face and the hands, of course. To be safe is, I think, the most important. So using the cannula, you have in the safer condition.
Okay, so many thanks. I think it was absolutely perfect. So Raphael, do you have any final comment concerning the dissection of the hands and what you would like to recommend?
One comment, because in the audience they ask, should we change plane if we inject fat or if we inject radiesse? Once again, I just repeat what I said at the beginning. If you go in the intermediate layer or deep layer, there is danger. So independently of what you're going to inject, you don't want to have problem, so you stay in the superficial layer. That's what I want to conclude.
Okay, thank you so much. So it was absolutely brilliant.